One day, 20 years ago, I made a decision that I wanted to help a child in need by becoming a social worker. In the book, 20 Inspirational Quotes for Social Workers, Mary Rose McGeady states, "There is no greater joy nor greater reward than to make a fundamental difference in someone else's life." 10 years ago, I had the opportunity to meet a great social worker named Donna while I was going through my adoption of my two daughters. In the article on turnover in child welfare posted in the online journal Children's Practice Notes, they write that the average caseload for social workers should be between 12 and 15 families, but because of shortages, social workers are given between 24 to 31, which doesn't allow them enough time to spend with each family, affecting the services each family and child is given. Today I will be informing you on why I chose social work, specifically child welfare, as my career choice, the education requirements, and the job description for this field of work. So let me start by first telling you why I chose this field. I met a girl 20 years ago, or about that time. I was in 8th grade. Her name was Debbie. She was in foster care. The reason why she was in foster care is because her mom was a drug and alcohol addict. And because of this, they took her away from her mom and placed her in foster care. She did get the opportunity to spend holidays and weekends with her mom, but her caseworker changed quite often, which affected her. In an article on turnover in child welfare posted in the online journal Children's Practice Notes, they report an example on how one county in Virginia reported a 60% turnover rate, and another in Florida reported an 85% turnover rate. This is due to lack of recognition, emotional exhaustion, tough working conditions, and being overworked. In the journal Child Welfare, published in 2013, the senior editor said he worked with a social worker he hypothetically named Patty. He says that Patty was negative, totally disgruntled, and had no reason to believe that children and families would ever be able to change. She felt this way because of burnout. Even though it has taken me 20 years to get this far and to actually fulfill my goal, I am going to make it happen. Next, I will talk to you about what it takes to become a social worker. The education requirements for a social worker in the state of Iowa is to have a licensed bachelor's of social work. There are 3 different social work levels in the state of Iowa, but I'm going to talk about the LBSW. On the website socialworkerlicensure.org, in the state of Iowa, you are required to have a bachelor's degree in social work in order to be licensed in the state. And it has to come from an accredited program. If it's not from an accredited program, you can't get licensed. I chose to go on after I graduate from Iowa Western to Nebraska Wesleyan University, which is an accredited program. Most bachelor's degrees in social work also require an internship. In one section published in the New World Encyclopedia, social work agencies collaborate with universities in training programs so that students are able to obtain supervised experience in actual professional practices. Before you can actually start working, you do have to be licensed. According to socialworklicensure.org, in order for me to obtain a license in the state of Iowa, I will be required to take the bachelorette level exam administered by the Association of Social Work Board and pay a license application fee of $120. The final thing I would like to share with you are the job duties of social workers. There's many different fields of social work that you can go on to, and the job duties are different. I'm going to tell you about the 3 that interest me. The first one is child, family, and school social workers, because that's the field I want to go into. These social workers deal with maltreatment. For example, my friend Debbie was maltreated by her mom because of her drug and alcohol addiction, which caused her to be removed. Debbie's mom was not completely off of drugs, so she aged out of the system. A school counselor works with like grief counseling. If the student has lost a loved one, they may help with that, so on and so forth. A family social worker provides referrals for mental health, for example, like mental health. If they have issues there, they may refer them out to an inpatient center. They also receive referrals on parents or families who may live in poverty, so they'll help them get temporary assistance for needy families. In a report on Iowa's children released in 2015 at CWLA.org, there are 20,330 families that are receiving assistance through temporary assistance for needy families. However, this number has decreased from 2013 by 19.6%. The next field that I want to talk about is a medical social worker. These typically work in hospital settings. They help with financial struggles by finding funding for them. They connect patients to outside resources once they get discharged. And they help you also understand treatment options, as well as give emotional support for people who have lost loved ones. Now let me review what you have learned today. In conclusion, you have learned why I want to become a social worker, the education requirements, and what the job duties are for 3 different fields of social work. Social work is a rewarding career, not only for yourself, but for children and families everywhere.